Good evening to everyone. Let me share my screen first. Am I audible and am I visible? Okay, thank you. So yeah, good evening from the Philippines. I am Vince Henry M. Salles, and I am here to present my study entitled The Communicative Role of Camillian Chaplains in Their Pastoral Ministry During the COVID-19 Pandemic. So as a backgrounder, as of November 4, 2021, there have already been more than 248 million COVID-19 cases worldwide, which resulted in more than 5.02 million casualties. And behind these statistics are real people who were really greatly affected by the pandemic. And the pandemic uh, not only affects the physical health of people, but also their psychological, their social, and their spiritual dimensions. Sickness, as we know, disrupts our equilibrium. And in order to achieve overall wellness, the spiritual aspect of a person must also be considered as well. Spirituality is essential in an individual's meaning and identity. And loss of this will impact immediately and substantially a person's well-being. Enabling the spiritual aspect of a patient's well-being should be considered side by side treatment and interventions necessary to address their health problems. And it is the role of hospital chaplains to meet the spiritual needs of patients and healthcare workers. The landscape of for hospital chaplaincy has changed so much due to the health risks brought about by the COVID-19 pandemic. And it has impacted how hospital chaplains communicate and provide pastoral care to the patients, to their families, and to the medical staff. My study will describe the communicative role of hospital chaplains belonging to the Order of the Ministers of the Infirm, or also known as the Camillians, before the pandemic struck, and how the pandemic altered their communication strategies that they employ in dealing with the hospital stakeholders. I conducted in-depth interviews with 4 Camillian priests serving as chaplains of hospitals and healthcare institutions taking care of COVID-19 patients. And this case study involved inquiry conducted virtually through Zoom. My initial plan for this study was complete enumeration for data. Hence, I asked for the list of all Camillian hospital chaplains in the Philippines ministering to COVID-19 patients. However, out of the 6 hospital chaplains identified, only 4 agreed to be interviewed. Although this study's sample size is quite small, the information gathered, I think, was adequate to provide rich narratives of chaplain work during the COVID-19 pandemic. The 4 chaplains were contacted and they were sent a message through the internet explaining the rationale of the study and the interview questions. And the research participants were informed that their identities would be protected with aliases. I transcribed the interviews, the recordings, and translated them to English. The transcriptions of the 4 interviews were presented in narrative form, which is descriptive and detailed. The 4 respondents for the interview are all priests. They belong to the Order of the Ministers of the Infirm, or the Camillians. I gave them the aliases Father Matthew, Father Mark, Father Luke, and Father John. Father Matthew belongs or is a chaplain in a public hospital here in the Philippines. Also Father Mark. Father Luke, on the other hand, is a chaplain in a public healthcare facility. And Father John, a chaplain in a private hospital. So before continuing with the study, I would like to give an overview of who the Camillians or who the ministers of the infirm are. So the thought of forming a congregation to minister to the sick occurred to Saint Camillus de Lelis after observing the poor conditions of hospitals in Rome and the poor treatment of sick people. In the year 1584, Camillus founded his congregation to relieve the ever-present merciful love of Christ for the sick and to bear witness to it to the world. The congregation was approved and confirmed by Pope Sixtus V in 1586, allowing Camillus and his companions to live together in poverty, chastity, and obedience, and in the service of the sick and the plague-stricken. It's noteworthy to note that Camillus also lived in a time of a plague, or what we call now as a pandemic, although theirs was just an epidemic because it was localized. Aside from their three usual vows of poverty, chastity, and obedience, the Camillians, the religious men and women of the ministers of the infirm, take a fourth vow, wherein they consecrate themselves to the service of the ill, even at the risk of their own life. And the presence of the Camillians here in the Philippines began in 1974 and was formally established in 2003. They live out their charism through hospital chaplaincy, administration of healthcare institutions, parish ministry, community-based healthcare, public health services, and seminary formation. And during this COVID-19 pandemic, the ministers of the infirm have been very active in their work for the sick. Although there were modifications to their usual ministry, they adapted and thought of creative ways to still pastorally serve the sick. And Camillian priests assigned as hospital chaplains still continued their apostolates despite the risks posed by the pandemic. So for the discussion part, Father Matthew summed up the duty of a chaplain into two. For him, a chaplain is a minister of healing and hope. According to him, minister of healing refers to listening to the voices of the suffering patients. He acknowledged that listening is not an easy job because you have to sit with the patients for hours. Father Matthew defined ministry of hope as not giving false hope, but rather bringing Christ to the sick in their lives. It's also making the patients appreciate God's hand at work so that they will have hope, even though their sickness is irreversible. It is making the patients hope for God's forgiveness of their sins. Meanwhile, for Father Mark, a chaplain is a representative of the church, a spiritual minister to safeguard the faith and to give the sacraments of the church to the people. He also mentioned about his role in providing spiritual formation to the hospital employees. Thirdly, for Father Luke, the primary task of a hospital chaplain is a spiritual accompanier for the sick and those who are taking care of the sick. He looks after the psycho-emotional needs of the hospital employees as well. And finally, for Father John, he shared that a hospital chaplain's regular duty is administering the sacraments, particularly the Holy Eucharist, anointing of the sick, and reconciliation. Hospital chaplains do not only take care of the sick, the patients, they also take care of the family members of the sick and the healthcare workers. So we can say that hospital chaplains have a lot on their plate. So let us now look how the pandemic affected the priest chaplains' ministries for the sick. As enumerated earlier, a chaplain's duties and responsibilities are very personable. They involve very personable acts, an encounter between peoples in which the patient's spiritual and emotional needs are met. Face-to-face presence and communication are essential in the pastoral care of the sick, and it engages both the chaplain and the patients in a meaningful and deeply human level. However, due to the restrictions necessarily imposed by the government authorities to contain the virus, pastoral ministry seemingly became depersonalized. So the question of one author named Daniel Nuzum may also be the question of many hospital chaplains now, struggling to provide spiritual comfort to COVID-19 patients. The question is, how do we remain pastorally close while physically distant from the patients? So although some of the chaplains that I interviewed were allowed to minister in person to COVID-19 patients, they had to wear what we call PPE, or personal protective equipment, so they can go near to the sick people. One chaplain that I interviewed commented that wearing PPEs or personal protective equipment is uncomfortable, but he knows that it's necessary to protect the patients and himself. In the ongoing onslaught of the pandemic, the work of hospital chaplains has increased in difficulty. They became like shock absorbers of the workers, the hospital workers, the patients, and their family members. And how chaplains handle the stresses of their job deserves another study. I'm now going to present the creative ways that the chaplains used to still connect with the sick people despite their distance. Firstly, the chaplains celebrate Mass wearing their personal protective equipment in a healthcare facility's lobby. And the Mass is usually attended by the frontliners, the health workers who are off duty. The Mass is being amplified using the hospital's sound system, composed of microphones and speakers placed in front of the building lobby, so that the patients inside the wards can hear the Mass at least. And during his homily, one chaplain that I interviewed, Father Luke, inserts encouraging messages for the patients and the healthcare personnel. The chaplains depend on the sound system to communicate with the patients inside the wards. They ask the patients to clap loudly or to shout, no, to tell if they are feeling okay, or if they already want to go home to their families. When the patients hear the voice of the priest, the chaplain, they immediately respond. The shouts and the applause of the patients are already enough feedback for the chaplains. Next, the chaplains also conduct, a kind of mini procession of the Blessed Sacrament inside the wards or along the corridors of the uh, facility after their Mass. The chaplains shared that they witnessed up close, no, the faith of these patients and the nurses who were intently praying while the Blessed Sacrament was passing by. The chaplain disclosed that he was so moved and inspired to see the people who expressed their desire for healing. Another is an online counseling for COVID-19 patients, persons suspected of having the virus, and the frontliners. These people usually tell the chaplain of the discrimination that they experience from their neighbors, from others. The people feel anxious and afraid because their community members tell them to leave their area. So these one-on-one counseling with the chaplains are conducted using video conferencing tools like Zoom or Facebook Messenger. The chaplains encourage them to continue their frontline job in battling COVID-19 even though it is exhausting. Next is a mental health awareness program organized by the chaplains intended for the healthcare workers to release their tensions similar to a stress debriefing to ensure their mental well-being. Some of the participants were previously infected by COVID-19 but were able to recover. The program became an avenue for the participants to share their intense feelings during the lockdown, especially when they discovered that they were infected with the virus. They gave very powerful testimonies on how clinging to God and having faith in Him helped them get through their intense fears of dying or themselves and their loved ones being sick. Almost all of them shared that their faith gave them hope. And because of their faith, they were able to feel the love of God and their families. One of the chaplains that I interviewed shared a rather extraordinary experience of ministering directly to COVID-19 patients in person. He was given a chance to minister to COVID patients 5 times to anoint them with oil at their family's request, and he obliged. He readily obliged. He recounted the procedure he followed in administering the sacrament of anointing. He prepared the holy oils in advance, as you can see here in the picture, and transferred them in sachet packs. because if one enters a COVID ward, whatever is brought inside should be left there. So before going inside the COVID ward, Father Mark, his alias, wore a PPE, personal protective equipment, 2 layers of gloves, and goggles. He approached the patients who were already intubated and recited the invocations from memory. He did not bring a prayer book because the prayer book, according to Father Mark, might be contaminated. So the patients were conscious and were aware of the chaplain's presence when he came. He said that one patient even opened his eyes, and the oil inside the sachet was dropped on the patient's forehead and the hands. After anointing, he threw away the sachet in a bin inside the ward since it's already contaminated. All the 5 who were anointed died afterwards because they were already severely infected. So hospital chaplains, aside from being with the patients in their sickness, also engage in an end-of-life care. And as Morris puts it, chaplains dwell in the midst of death and dying. Chaplains walk with the wounded. This is perhaps one of the hardest things to do in life of a hospital chaplain. One chaplain shared that he was able to bless the remains of a person who died due to COVID-19. The remains of the person were already in a black body bag, and he blessed it at the corridor after being discharged from the morgue. The chaplains were able to celebrate a mass for the dead in order to accompany the grieving family. So in practical considerations and recommendations by the World Health Organization for religious leaders and faith-based communities in the context of the COVID-19, they acknowledge the role of religious leaders as major and primary in saving lives, reducing illness, and being a source of support, comfort, guidance, and direct health care and social service for the people they minister to. So as a recommendation for this study, priests, chaplains who are willing and healthy and have followed health protocols must be allowed inside COVID-19 wards to anoint, or if they can, to hear confessions of the sick and the dying, or just be with the patients who suffer from isolation. And if in-person ministry is impossible, government authorities, after referring to this study, could provide ways for hospital chaplains to reach out to the sick even virtually. For example, by connecting them to private and public hospitals or giving them communication technologies. This study may also be used as a model for other hospital chaplains serving COVID-19 patients, their families, and the hospital staff. The narratives are good examples of communicative techniques and dispositions that may be used in ministry. And it is recommended that this study be replicated among other religious congregations focused on the well-being of the sick, or among the diocesan clergy who are assigned as hospital chaplains. So thank you very much for listening, and have a